You know, there's something we rarely talk about as we age, something many people quietly wonder, but few ever say out loud, am I overdoing it with my health care? That might sound odd at first. After all, we've been taught our entire lives to trust the doctor, to get the screenings, to stay ahead of problems before they start. But what if, after a certain age, some of these checkups actually do more harm than good? If you're over 70 or caring for someone who is, this message is especially for you. It's not about ignoring your health, far from it. It's about taking control of it in a new, wiser way. One that aligns with what your body truly needs now, rather than what made sense 30 years ago. Because the truth is, some tests and procedures that are routine for younger adults can cause unnecessary stress, pain, and even real harm in our later years. So stay with me. Because by the end of this conversation, you'll not only know which 5 checkups to think twice about, you'll also understand why skipping them might actually be the healthiest choice you can make. And more importantly, how to talk with your doctor about it in a way that keeps you safe, respected, and heard. Before we dive in, I want to gently ask, if this topic resonates with you or someone you love, consider subscribing or sharing this video with a friend. It's amazing how much peace we can bring to others just by starting the right conversation at the right time. Now, let's take a step back and think about the bigger picture. Health isn't just about lab results or numbers on a chart. At this stage in life, it's about quality of days, quality of movement, quality of relationships, and peace of mind. It's about feeling secure in your decisions, not second-guessing them after every appointment. Let me share something personal. My own father, a proud man who lived into his late 80s, once told me something that stuck. The older I get, the less I want to fix things that aren't broken. He said it after coming home from a long afternoon of tests, some of which left him bruised, anxious, and unsure what the point of them even was. He wasn't complaining, he was just being honest. And I think that kind of wisdom often gets overlooked in our system today. In fact, many older adults go through invasive procedures or repeated screenings that were designed for people decades younger, without anyone stopping to ask, does this really make sense for me anymore? Not just medically, but emotionally, spiritually, in the context of how I want to live my life? Let's talk about one example that illustrates this perfectly. A woman named Linda, 74, energetic and sharp, shared her story with a support group I once facilitated. She had gone in for a routine colonoscopy, something she had done every 10 years like clockwork. But this time, the prep was brutal. She felt dehydrated, dizzy, and for days afterward, she was just off. She ended up in the ER from fainting due to dehydration. And guess what? The results showed nothing new. Nothing that would have changed her care. If I had known the risks, she said, I might have made a different choice. Now, to be clear, this isn't about ignoring medical advice or being reckless. It's about informed decisions. It's about recognizing that after 70, the conversation around checkups needs to change. And thankfully, more and more doctors are starting to agree. The American Geriatric Society, for example, emphasizes individualized care for older adults, meaning your decision should be based not just on your age, but your health status, personal goals, and values. What matters to you? Living pain-free? Avoiding hospitals? Staying independent at home? These goals should guide your checkups, not a checklist designed for someone in their 40s. And if you're thinking, but isn't it better to be safe than sorry? I hear you. That phrase has been used so often in medicine that it's become a kind of shield. But sometimes, in the name of being safe, we expose ourselves to procedures that lead to stress, false alarms, unnecessary surgeries, or worse, diminished quality of life. One powerful example of this comes from Dr. Atul Gawande, a surgeon and writer whose book Being Mortal dives deep into this very topic. He talks about how medicine often focuses on extending life rather than improving the experience of living. And for seniors, that focus can sometimes become a burden. We need to shift from how long can we live to how well can we live? So, as we begin to explore the 5 health checkups you might want to avoid after 70, remember this is not about fear, it's about freedom. The freedom to say no when it's appropriate. The freedom to ask questions. And the freedom to trust your own sense of what's right for your body and your life. We'll start with one of the most common procedures that sparks debate, the annual full-body cancer screening. It's often offered as part of a preventive package, sometimes by private clinics or health plans that want to give you peace of mind. But for people over 70, especially those without a history of cancer or risk factors, these tests can lead to something called overdiagnosis. Overdiagnosis happens when you're told you have something abnormal, but it's a condition that would never have caused problems during your lifetime. Yet suddenly, you're on a roller coaster of follow-up scans, biopsies, surgeries, and medications, all of which carry their own risks. It's like finding a tiny crack in the wall and deciding to tear the whole house down, just in case. And here's the irony, many of these findings never become dangerous. But once you know they're there, it's hard to unknow them. It creates anxiety, a sense of being sick even when you feel perfectly fine. That's the emotional cost of excessive screening, and it's very real. A 2019 study in the Journal of the American Medical Association found that many older adults receive cancer screenings even when the potential harms outweigh the benefits. It's not because doctors don't care. It's because the system is still catching up to a more compassionate, personalized approach to aging. That's why conversations with your primary care provider are so important. If you feel uneasy about a test or aren't sure it's necessary, ask questions. Questions like, will this test improve the way I feel or function? What are the risks if we skip it? Is there evidence it helps someone my age with my health status? Good doctors will welcome these questions. In fact, they often wish more patients would ask them. Let's pause here for a moment and just acknowledge something together. Aging isn't a problem to be solved. It's a season to be honored. Your body is not a project to constantly fix. It's a living record of all you've survived, all you've felt, all you've loved. Some lines aren't meant to be erased, so before the next appointment, before the next test, take a breath and remember that you're allowed to choose what matters most. Maybe that's time with family. Maybe it's feeling steady on your feet. Maybe it's sleeping well, laughing more, worrying less. This shift in thinking toward mindful, intentional healthcare isn't about giving up. It's about stepping up into your power as someone who deserves dignity, not just treatment. We're just getting started. In the next part, we'll explore the second checkup to be cautious about after 70 and why the risks may surprise you. The second health checkup to reconsider after 70 is the bone density scan, commonly known as a DEXA scan. Now, don't get me wrong, protecting your bones is essential, especially as we age. Falls are one of the biggest health threats for older adults. But here's the twist, getting repeated bone scans after 70 often doesn't change your treatment, and in some cases, it can lead to more worry than wisdom. Let me explain. For many people in their 70s and beyond, a baseline bone density scan may have been done years earlier, often around menopause or after age 65. If you're not at high risk of fractures, and especially if you've already been diagnosed with osteoporosis and are on treatment, repeating the scan every year or two often doesn't give you much new information. In fact, many doctors now agree that unless there's a major change like a sudden fracture, long-term steroid use, or rapid weight loss, there's little benefit in doing these scans routinely in older age. The reason? your treatment likely won't change. What helps bone health at this point is consistent action, weight-bearing exercise, adequate calcium and vitamin D, fall prevention, and managing other health conditions. The scan becomes less about action and more about data, and sometimes that data only adds anxiety. A patient named Charles, 76, told me that after his third DEXA scan in 6 years, he felt more confused than ever. They told me my numbers dropped a bit, but not enough to change meds, he said. So why did I put myself through it again? That's a fair question. Because the stress of medical testing can weigh heavy. Even just the fear of the results can affect sleep, mood, and motivation. That's not the kind of weight we need in our later years. And here's another consideration: the labels we're given, like osteopenia or low bone mass, can sometimes cause more harm than good. These terms aren't illnesses, they're statistical categories. But to the person hearing them, they can feel like a diagnosis, like something's wrong with them. When really, for many people in their 70s or 80s, mild bone thinning is just part of the natural process of aging. Instead of fixating on the numbers, the better focus is on balance, strength, and fall-proofing your environment. Things like grab bars in the bathroom, better lighting at night, non-slip shoes, and even practicing Tai Chi, yes, really, Tai Chi, can reduce fall risk far more than a printout from a machine ever could. This brings us to a broader truth. What's measurable isn't always what's meaningful. You might not be able to measure the strength of your intuition or your confidence on your morning walk, but those things matter more than any scan. And the good news is, you can build those every single day without a single medical test. Now, you may be wondering, but what if I want to keep track of my numbers, just in case? That's perfectly valid. The key is to know what you're hoping to gain from the scan. If it's reassurance, be sure the scan will actually provide that, and not just more questions or watch and wait recommendations. If you're not going to change your medication or your habits based on the result, then maybe your time and your peace are better spent elsewhere. Let's move on to the third checkup that many experts now say should be used more cautiously in older age. PSA testing for prostate cancer in men over 70. This is a tricky one because prostate cancer is common and the PSA blood test is simple. But here's the challenge. The PSA test often finds slow-growing cancers that never would have caused harm in your lifetime. Yet once they're found, they almost always lead to more tests, more biopsies, more decisions. Now imagine you're a 75-year-old man, relatively healthy, enjoying retirement. You go in for your checkup and your PSA is a bit elevated. Your doctor refers you to a urologist. You get a biopsy, which is uncomfortable and carries risks like bleeding or infection. Then comes the agonizing wait. The result? Low-risk prostate cancer. The recommendation? Let's just monitor it. So you're back every few months for blood work and imaging, caught in a loop of worry for something that may never have affected you at all. That's the PSA paradox. In fact, the U.S. Preventive Services Task Force recommends against PSA screening for men over 70 for exactly this reason. Not because prostate cancer isn't serious, but because, statistically, the risks of treating it at that age often outweigh the benefits. And if you're someone who's already been diagnosed with prostate cancer, or if it runs in your family, that's different. Again, personalized care matters. But if you're simply going for routine testing out of habit, it might be time to revisit that decision with your doctor. Ask, what would we do with the results? How likely is this to affect my quality of life in the years ahead? And are we treating a person or just chasing a number? One elderly gentleman I knew, Ben, 82, put it beautifully. He said, "I want to be vigilant, not paranoid." That's the balance we're aiming for. As we think about these screenings, cancer tests, bone scans, PSA levels, it's easy to feel overwhelmed, but it's okay to slow down and reflect. You've earned the right to ask, what's right for me now? Not what was right 20 years ago. Not what your neighbor is doing, but what feels aligned with your goals, your comfort, your peace of mind. Because aging gracefully isn't about doing everything. It's about doing the right things with intention. And sometimes that means choosing less so you can live more. You're ready. I'll take you through the final 2 checkups that deserve a second thought, especially if you're aiming to stay strong, steady, and serene in your 70s and beyond.